I'm Bianka Carstens. I'm a veterinarian specialised in horses, and since 2004, I am based in Rottenberg and self-employed. In 2006, I decided to specialise in complementary medicine with American chiropractic, and for the last 10 years, I've been working with bioresonance in addition, here in Rottenberg or outside with small and large animals. I was working as a veterinary specialist and then decided that I wanted to orientate myself towards holistic or complementary medicine. I was always on the lookout for something more, as something was missing. With the American chiropractic and acupuncture, I could already cover a lot, but I was still missing something to be able to treat, for example, chronic disease allergies or things which are difficult to grasp. I had heard of the bioresonance method and thought there must be something nearby, and so I waited, thinking there must be something near me. This energy must have generated attention, and 3 days later I was coincidentally invited to an information evening. I attended and was so enthusiastic. I thought that if only half of what is said here is true, I want to have such a thing. I now know from my experience that this is true, and actually much, much more. The next day, I immediately ordered a device and treated first myself. Back then, I was also an asthma patient and highly allergic to dogs. This was always a problem because I could not treat dogs. If someone came into the practice with a dog, I would immediately have an asthma attack. It was a no-go. So I got to the therapy right away, and since then I have no problems with dogs. I can even stay overnight with friends who have dogs. This is for me the best example that it works. After my studies, I first worked with conventional medicine. I worked at the university in internal medicine, and of course I had a lot to do with horses with lung problems. When I came to be a veterinary specialist, I also worked with classical equine medicine. It's great, and I would not want to be without conventional medicine, but I have also seen again and again cases where it reaches its limit. One has to look for options, and this is when it gets a little tricky. If it's not just a classic case of a small cough or colic or lameness, but for example, if it's a metabolic disease or an allergy, which at first seems to be a bit hidden, then you have to look more for what it is. Nowadays, BICOM helps me a lot because I can find solutions very quickly and I can find out where the cause is. This was always very important to me, to have this holistic approach, to look for the cause, to think, do I have an allergic problem? Do I have a viral problem? Are bacteria to blame or maybe some kind of parasites? If I want to check everything with conventional medicine, it takes quite a long time. I need many samples, and during this time, it is often only treated symptomatically. The symptomatic treatment sometimes also disguises the problem. So here I can simply test in a very short and very fast time to find out what the possible problem is and then base my therapy on it. I integrate it often into my other therapy offerings. My first pillar is still American chiropractic, as I am specialised in this. Here, though, I often have cases where I am unable to reach patients as therapeutically as I would like. In the case of new clients, for example, a dog or horse with allergies or allergic symptoms, I will also do a chiropractic checkup to examine the nervous system. Everything is based on this, and I have to imagine how the brain and spinal cord not only reach the musculoskeletal system, but also all the organs. The main areas of application for bioresonance with me is then allergies. This is quite clearly at the top. I find it unbeatable. Then also with the musculoskeletal system and everything that is related to it, and also when I have a metabolic disease for supporting it. I work here a lot in the practice with nutrition, and it is possible to test which feeds are feasible for the animal and what I can give to support the animal. Here I can work super well with it. With the large animals, it's clear. I am on the second floor, so for these animals, I drive to the stable or delegate it to my helpers if the programs are clear, and I know what I would like to do or to examine or test. Then there are other patients, for example, cats or dogs. Overall, all animals can be treated well, even fish. A collie puts the whole aquarium on the mat, which is totally practical. There is no harm to the animal, there are no side effects, and you have a good response when doing this. When someone comes for therapy and wants to have bioresonance, it depends on the indication and what pre-existing conditions we have. With me, it works like this. I make the first assessment, I make a first test, and there I test a lot of different things to get a clearer picture of the patient and the causes. Then I discuss a care plan with the owner. In doing this, I have found out the burdens. I have, for example, found out that the animal reacts here and there allergically, and that we probably need 3 to 5 treatment intervals or possibly 8 to 10. It depends also on how the animal is energetically, if it is reaction blocked. I must first build up the animal energetically so that we can even get started. And then you see on the basis of the therapy course how the animal develops. I then always test for the next interval. These are my individual treatment steps. I do this every 2 weeks and then also give the owner globules, which are imprinted with the body's own frequencies and frequencies which resonate with the patient. In these 2 weeks, a lot can happen as the body reacts. The owner says, yes, this and that has changed, and I can also see this on the basis of the testing. For example, I no longer detect heavy metals, or the blockage is no longer there, or the shock incident is gone. This can be very well differentiated. You can see that the patient is on a good path, it comes gradually, and as other things come out or are not detectable anymore. I work with conventional medicine more or less in the background. I'm glad that I have this training and I have enjoyed very good training. It runs in the background and I already check some things with it. With this, of course, the diagnostics and different diagnostic components are also involved. So if I have an animal, for example a dog with a food allergy, or where I immediately think it could be a food allergy, then I have this, of course, already. I can already be thinking that it could be this or this or this. With bioresonance, you can also test, and again, I find that to be very practical. Sometimes you have some disease patterns where you think that it could be bacterial or could be viral or could be a parasite. If I now think of before that I would had to have given everything to the laboratory, take samples or possibly send various bloods to the laboratory because I wanted to clarify this and that, now I can do everything in the shortest time on a device and then know exactly the way forward. I can find out quickly the cause and then treat in a very targeted way, which is very time-saving for the owner. What I find out is very cost-saving, and the therapy plan can be based around it. Last year, I had quite an exciting case. An old Anglo-Arabian, a gelding in his mid-20s. I have been taking care of him with chiropractic for over 10 years. I visited him and he had hair loss everywhere, so far that he was completely naked in places. As soon as you touched him, you would have tufts of hair in your hand. I thought that we must check him with bioresonance to see what is there, and thought he would certainly need 4 to 5 treatments to stabilize him again energetically, to build him up and do elimination. After 1 treatment, I called the owner and asked, "How does he look? How is he doing?" And she said, "The hair is sprouting everywhere." After 2 treatment sessions, he looked pretty good, and after 6 weeks, he had such a shiny coat. I had not seen him so good. That was already very impressive, because it really went so fast and so successfully. I also have another horse that is very memorable, a head shaker. This is when horses beat really extremely with their head, and it's usually a bit tricky to find out what is the cause. It can be allergic, it can be caused by the musculoskeletal system, it can be caused by viruses, so I thought I should simply check it out with bioresonance. My colleague had already treated and tested everything with conventional medicine, and there was no diagnosis. After 1 treatment, it was gone. I couldn't believe it. I said we must do it 2 or 3 times, but the owner said, "No, there's nothing more there, thank you." I did some more treatment to stabilize, and the horse never shook again. That was cool. How do I get my patients? In fact, I get over 90% by word of mouth, and some come through the social networks. The owners are usually networked or search for it themselves. If they have long and difficult problems, they also look at Facebook groups or WhatsApp groups. They look at what has helped others. From time to time, the bioresonance method is mentioned, and then they look at where this therapist is located. Yes, that's how most people come to me. With horses, it's of course also through the stable colleagues, or, as I have it here in the region, through colleagues who work in conventional medicine and say, yes, let's go to Bianka. She has such a device, and we don't know how to proceed further. They know they will not lose their customers because then I only do my job. I don't offer worming or vaccinations, and I don't try to bind the patient to me. Instead, we work together, and that's really nice. I think that with bioresonance, you have a huge field in which you can take advantage of where conventional medicine either struggles or can't offer solutions. I used to work at a university in internal medicine. We have many lung patients, horses with chronic coughs. What you have there today has improved a bit, but you simply don't have so many options. It's always like this. You first have the herbs, and then there's this medication and that medication, maybe a lung irrigation, but you reach your limits relatively quickly. Maybe there is an allergy therapy which one responds to, or maybe not. If I know that I have more options and I can simply find out the cause in the shortest possible time, find out what we have, and then deliver targeted therapy, that is simply a huge plus. I have a colleague who says, yes, but I don't have time for that. I have a normal practice routine to run, but it can be delegated very, very well. One just simply uses this device, the BICOM, which has a lot of protocols already in it. That means that I can also work symptomatically. I can simply enter an indication. I can also enter goodies, for example. Maybe you want to give someone a homeopathic remedy or something allopathic. It's just so diverse. It's a box of wonder. I would not want to be without it. I would wish for two things. The first, I would wish from colleagues who only work with conventional medicine just to listen to what other therapists working in other ways say, even if it's not yet 100% scientifically proven. It does not mean that it is not provable, but simply that our devices are working in a different way that does not make this possible. I don't even listen anymore when someone says to me, okay, but I can't imagine how that should work with only some frequencies. I've been doing this for about 10 years now with such a success that I can say I don't need this scientific proof. My patients come by word of mouth because I have been able to help so much, and this just speaks for itself. Then I would also wish for something which I do already have in the region where I work. I wish that there would be more and more people that would be willing to say, okay, let's just try it out. I may not want to do it myself, but there is a colleague where I can send my patients and know that I will also get them back. That would be quite nice. For the owners, I would also wish for more independence and empowerment. With bioresonance, we can heal very, very well and help in a way that has no side effects and no stress for the animal. We can perhaps bypass the surgery. That would be really cool.